Preparing to live stream. And we are live. So welcome everyone tonight. We are, as promised, coming on our platforms to discuss our upcoming vaccine clinic that is trans, trusted, and approved. We are here tonight with some medical professionals and from UPMC, and we're just going to discuss how this is going to go. It's going to be a very laid back conversation. Folks with any questions at all, feel free to drop them in the chat. Also, please share this live to get it around the community so folks who are unaware can be aware. Those who are skeptical cannot be skeptical of how important it is to make sure that folks have access to vaccines. And we're going to start it off with Joy, who is going to let you know how to first register. And while that is happening, again, feel free to jump in the chat and put any questions you have in there, and we will go from there. And I'll turn it over to you, Joy.
Thanks so much. Hey folks, my name's Joy. I work for UPMC. My pronouns are she, her. And I'm going to share my screen and show y'all the form that you can use to register for the vaccine. Can you all see that? Good. Okay. So this is a Microsoft form that'll feed into the medical record that we're using. Just so you know, when you're going to be navigating this, anything that has a red asterisk it's required, and it's actually not required by us. It's being required by Pennsylvania so that they can make sure that vaccine distribution is happening in an equitable way. And so you'll go to the first drop-down box, and you actually you can pick any clinic that you'd like to that's in here. But if you see the SisTers PGH on Sunday, May 23rd from 12 to 4 is right there. So that's the one that I hope you'll be picking and joining us. And then giving a range of times that are good for you. So if you want to go somewhere between like 12 and 1:30, beginning of the clinic, middle of the clinic, or toward the end of the clinic, and then you'll be contacted back with an appointment. You can pick your prefix, so your honorific. I will say MX was supposed to be in here, and it's not. You will see when you go on it, if you go on it tonight, it is the longest list, including like Archbishop. So we will get that added because I think if Archbishop can be there, then MX can be there too. Pronouns, which we're doing some work on opening that up even more with a drop-down box, but giving some options for right now. We are data collecting legal name, and the reason for that is because that will go on that CDC card. We're not policing that, so you can write down whatever you'd like on there. Just know that whatever's on that card, it might be something that you'll need to use at other times in the next year, and so it's just worth thinking about, like, how is it going to be best utilized for you. We have a field for a name that other than your legal name, if you go by that, date of birth, legal sex, other things. If you are unstably housed, you can choose to use an address. So one of the things that we had discussed was possibly folks using the SisTers address as an example. And so that should not be a barrier for you. We've done clinics with lots of people who have different kind of housing situations. Same with email. You can really put anything in there. You can put anything in there for telephone number. There is a section for ethnicity and race. You do not have to report that if you don't want to, so you can decline to answer either of those questions. That's totally up to you. And once there's some other things about language preference, or if you're differently abled, as well as the possible need for transportation. We're using that to make sure that we're able to meet all different kinds of intersectional needs. And then there's some questions about the vaccine. Once you submit that, that'll go into the database we're using for the clinic, and you'll be contacted back with an appointment. Here's the thing: if you register and you don't have a phone number and you're not sure what your appointment is, just come between 12 and 4. If you show up at 12 and your appointment's at 1:30, we're going to get you a vaccination. If you show up at 3:30 and your appointment was at noon, we're going to get you a vaccination. So, we have to do some data collection, but we want to make this as easy for y'all as possible. So we'll make sure you have access to that. Are there any questions about the form before I stop sharing my screen from anyone? Siora, you're on mute.
Here I go again. No, I was saying I don't see any in the chat so far, so I think we're good.
Okay.
But I do want to reiterate that we at SisTers PGH have been working closely with Joy and the team to make sure that the forum is as intersectional and inclusive as it can be, to make sure that we are capturing all communities within our TLGBQIA plus communities of Pittsburgh, Allegheny County, Mon Valley, all those areas that we service within Pittsburgh. And again, if you need to use our address when registering, our address is located on our website at www.sisterspgh.org, as well as our Facebook page. And if you happen to have a pen and paper with you right now, or Misha, go ahead and drop it in the chat, 2014 Monongahela Avenue in Pittsburgh, PA 15218. And thank you again, Joy. Now we're going to transition this over to our amazing doctors that has been doing this work to provide these vaccines for community members, to make sure that we do have access to competent service, competent medical provision, and just to making sure that we have all the information that we need when getting these vaccines. So I will open up the floor to our doctors, to our panelists, just to introduce yourself, your pronouns, and just a little background about yourself, and then we'll jump right into the questions. And we can start with Dr. Kim.
Hi everyone, I'm Ken Ho. I'm an assistant professor in the Division of Infectious Diseases. My pronouns are he, his. And I started out mostly in HIV prevention, and as the pandemic hit, sort of pivoted over into COVID research, both epidemiologic as well as vaccines. So we did, along with G. Martin and Sharon Ridler, the phase 3 trials of AstraZeneca, and then G. Martin did Moderna, as well as the Janssen study. I also participated in the ensemble study, which is the J&J vaccine, as a study participant, and received the vaccine through the study, which I thought was which was actually a very good and interesting experience as well. So I'm going to go ahead and stop right there and pass on to the next person.
I'm talking on mute again. So I'll go ahead and pass it to Dr. James.
Good evening, everyone. My name's Elena James. My pronouns are she, her. I'm really excited to be in communications with you and happy to answer any questions that you have and have discussion and dialogue. I think that is so important for us to be able to voice our concerns and have discussions that give us knowledge and make us powerful and impactful to make wise decisions. I serve as a medical dermatologist at UPMC in Pitt, and I am also the course director for a new course called Racism in Medicine, where we also discussed intersectionality and its importance in medical care, and really personalizing and reaching out to communities to understand where their concerns are, as opposed to having you come to us. We're happy to come to you.
Thank you so much for being here. All right, and we'll go ahead and hand it over to Dr. Ufamata.
Hi, my name is Ella Fomata. My pronouns are she, her. I am a general internal medicine physician, so I do primary care. I also do hospital medicine. Within my primary care practice, I provide gender affirming hormone therapy. So I see a lot of trans folks in my practice. So if you're looking for a primary care doctor who can help, give you comprehensive care, you can come see me, or I can point you, I can give you some recommendations. I'm assistant professor of medicine, and I am the curricular thread lead for social medicine in our curriculum, which sort of encompasses a lot of intersecting identities and sort of ensuring that we are graduating doctors who are going to be more culturally aware, have more cultural humility, and be able to take care of diverse populations. Thanks for having me. Really excited to have this conversation today.
Of course, thank you so much. And thank you all so much for being here. It's really, really a pleasure. So let's just jump into it, into those questions that, that has been in everyone's mind. But before, just a little housekeeping for our friends and neighbors who may be more comfortable in another language or looking for another language for this. There's also a phone number with Spanish, Nepali, Arabic, Vietnamese, Mediterranean, and Russian for scheduling the vaccine language line, which is at 833-660-2416. Again, that is 833-660-2416 for anyone else who is looking for this in another language. And yeah, let's get right into it. So without further ado, the Tuskegee study. This has been on everyone's minds. I know this is a pandemic, a new pandemic in my lifetime, in a lot of our lifetimes. This is the first time we have experienced something like this. And I know when this first came about, and then the vaccine seemed to had come within, I know it wasn't weeks, but it seemed within weeks of, when the pandemic first hit. And we were hearing all these things from the then administration about vaccine rollouts and what that's going to look like. And it was scary to folks, especially the Black and Brown folks who were skeptical, who may not be a vaccine person, right? To even want to get vaccines. So we want to just dive into that around trust. What does trust look like with this vaccine? And we can just popcorn it around to everyone. So whoever wants to start.
Sure, I can start. So thanks for bringing that up. I find that that's something that a lot of people have concerns about and want to talk about. And, as a Black woman myself, I obviously understand the mistrust that the medical system has earned towards Black people in this country. The Tuskegee or untreated syphilis study being one example of many examples where Black folks were not given access to treatment that was available for syphilis and left to suffer with the consequences of advanced syphilis disease. When I think about that, and I think about the COVID vaccines, in my mind, they're sort of like two different things. This is like, that to me is an example of where we were not giving access to treatment that was available. We were not given access to preventative care that was available. While in this case, like, the vaccine is available, the vaccine is effective, and it's something that can prevent against COVID, which is something that's prevalent in our society right now that we're dealing with. People are having lots of consequences from COVID, and it's available to us. And I think especially with clinics like this, where you're actually bringing the vaccine to the people, you're trying to meet people where they are, hosting events like this to make sure that you're giving information, like Elena said, information is power, making sure people have their questions answered, very, very, very valid questions answered about what does this mean, what's the safety. So, definitely taking full advantage of things like this to get those questions answered. and also to ensure that we give access to everybody to this vaccine, because we know that it works and we know that it prevents people from getting COVID. So I think I love that you brought that up off the bat, because I know people worry about it. And the other piece is how fast the vaccines were made. And the interesting thing is that this technology isn't new, but it was a technology that nobody was funding, nobody was putting money towards. And then this pandemic, this COVID pandemic hit the world, and all of a sudden, it's economically important to fund this research and to get it done. So we have the smartest people in the world working on this. Dr. Kismeta Corbett is a Black woman that I stand for, and she was like on the development team with Moderna for this vaccine. So they put the smartest people in the world on this and all the money towards it, and that's why we were able to get this result so quickly. And I'll let others chime in as well.
So coming at it, I think a little bit from the research side as well, and I think at the very beginning when we started to do trials of the vaccines, there was a lot of concern. I think from the beginning that, for example, participation in the trials would not involve communities most impacted by COVID, Black and Brown communities and such. And so Dr. Miller, Dr. Martin, and Dr. Ridler, who are all who I work with and who are just wonderful. They kind of put together the Community Vaccine Collaborative to kind of have these conversations about having representation in the studies, and then also trustworthiness between communities and the medical and scientific institutions. And I think that was just very, very important, because it made us, I think, as researchers, sort of take a step back and think, okay, how do we engage communities, and how do we arrive at a place where people will be like, yes, and we didn't know at the time if this would work or not, but assuming it worked and it did, then we're in the position of like saying, okay, we have something that works. How do we actually earn your trust and kind of put forward this intervention that will help us get to a better place, will help save lives and things like that. And I think one of the very first things was just to kind of sit there and listen, because I think as kind of academicians, we are like, oh, this is, how do we know this is not another Tuskegee? And then we'll kind of launch off into, well, we have IRBs and we have all these things and blah, 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 blah. And I think it's kind of all lost if people don't actually trust you and know where you're coming from. So I think this is where the listening piece and saying, I think even the acknowledgement that, we come from an institution that is guilty of exploiting communities of color in the past, and that we are now committed to reversing that, to kind of to undoing all that, and meeting people where they are presently.
I agree, and I echo everything that was stated. I myself have a distrust of the medical system, even being within the medical system. So that says, a lot. And so I had my own personal fears. Initially, I think that the time duration and the results that we have seen from the vaccine are exceedingly great. And it's really important for us to look closely at that data, and we have data at hand. So the trials, the experiment portion of it has passed, and we see that it's very, very successful. So we have the information. Before we didn't. And, I myself was leery as to how this was going to work, what was going to be the impact. But now we have data, and the data supports that the vaccine is safe and it is effective. And that can really, knowing that information and knowing the numbers, yes, there are side effects. Yes, absolutely. And yes, there are very rare cases, but the government, doctors are staying very aware and up to date on what's happening. And we have good references, good information to back this information up. So we're now at this stage where we have information. And so now with this information, you get to make a decision and you are informed. It's an informed decision and you can make that for yourself. And so I've had myself vaccinated, my elderly parents have been vaccinated, and now my children, 4 children, have been vaccinated. And that is for, we always want to look at risk and benefit. And the risk of getting the vaccine is very low, the side effects very temporary, and the benefit is great in so many ways, right? We are protected. We have less, risk of having problems or complications. And we know that in Black and brown communities, that the risk of having huge complications, right, are very high and very serious. I've had a 49-year-old cousin pass away from COVID, and that's devastating. And so having the access to it and having access to it within your community, I think it is so great that there are opportunities for you to go where you want to go in a community that you trust, right? To get your vaccine. You're not going to someplace, foreign or a clinic that you don't know. Are people going to treat me right? Are they going to be okay with me? But the opportunity to go to SisTers Pittsburgh and to have your vaccine there is huge, or to have your vaccine where you feel comfortable in your community is so great. And then the benefit of being able to reclaim, our activities, right? Our life, our engagement safely once you're vaccinated is so powerful. And that fear, I remember the relief after I got, my vaccine. And I was just like, wow, I'm still going to protect myself. But it was just a sense of calmness, right? They came over me from that. And so, again, to emphasize, we have the data, we have the research to back up the effectiveness of this vaccine, and you get to choose where you get it, when you get it, and I encourage you to take all of that into consideration.
Thank you so much, Dr. Tripp. I know you just got here with us, but if you want to introduce yourself, sorry I had to get off the camera real quick. My doorbell's ringing, all this stuff's happening. But if you just want to introduce yourself, tell us a little bit about yourself. And we were just talking about just trust, with the vaccine.
Sure, no problem. Thank you. And I apologize for being late. And I understand the doorbell. I got the Ring doorbell so I can check people out before I have to move from my comfortable seat. But my name is Dr. Raquel Tripp, or Ricky Tripp, and I'm an emergency medicine physician. And I work with these lovely people who you have online. And I would say from the frontline perspective, or the emergency medicine perspective, one of the things that I remember when the vaccine had come out, I also had hesitancy, also mistrust, similar to what my colleagues have said, where I was like, you know what, like, why do the Black people have to be the first people? Like, you know what, let me just let some other people get the vaccine first, and then, I'll see how it happens, and then I'll get it next. And I will say one of the things that happened to me was similar to what Elena was talking about, where I had 2 family members who died from COVID-19. One, my cousin who's 42 in Detroit, and then another great uncle who was 80. And interesting enough, was like they were going to birthday parties, going to barbecues, because like Black people, we love being together. We love that unity, that Black excellence that we're able to have. But however, we're killing each other. And that was the thing that really hit me, of that we need this vaccine to really keep up our culture, to really invest into put on that, summertime, exactly. Yes, but we need to do that in a safe manner. And for us to get the vaccine that is going to protect all of us together. I will say one of the most depressing times that I had, especially being a frontline worker, was in December, where it was at the height, and literally one of the ICUs, they actually ran out of body bags because so many people were dying. And Black people were dying 3 to 4 times more than white people. Latinx people were dying more. So it was just literally really hit home to me, where I'm watching my sisters and my brothers die. And I'm like, there's a simple solution that can really help to prevent those very severe cases for intubation or for death. And that's where that vaccine is going to be coming into, where it's protecting against those severe cases. So now I don't have to go to as many funerals per year as I need to due to COVID-19, something that we can help to prevent. So, so that's where, for me, I would say, why understanding the trust, hesitancy, things in that nature, where, with different things that have happened in the past, especially with Black people and our history with government, like definitely that is valid concern. And just recognizing that, as that informed consent that Elena was talking about, you want to make sure that you have the correct information. There's so much information overload that I've seen Instagram, I've seen people talk about, like, oh, you need to go out into the sun and then you'll be cured by COVID-19 because you get the vitamin D. So there's different things that I've heard and different theories, but however, really trust in those scientists. They're intelligent, they're smart. We have a collective. So this is like the first time I would say in history, really, that we're having a collective around the world to develop these vaccines. So not just, this is only for United States. No, this is something pandemic. Every single continent is engaged in this pandemic. And that is why a solution took a collective of thousands of people in order for us to get this. So that's my only emphasis I want to say. But thank you so much, everyone.
Of course. Thank you all so much for answering that question. Yeah, I was one of those folks too, very skeptical, very, very, very skeptical, from the gate, and even to the point of, wanting to make sure that my community was safe, or TLGBTQIA communities was safe, but also making sure that, they're doing this on their terms. This is not a situation where, I'm personally pushing them, in the door. This is on your terms, your decision. You can talk to medical professionals. I'm not a doctor, and you can have those conversations. And that's why we were bringing this panel here tonight, to talk to medical professionals, and especially those of our community. I know a lot of us, we want to go out and get our groove on and travel and do all those good things. But it is a good thing just to hear these things out, hear them out, and to make the best informed decision for you as an individual within our TLGBTQIA community of Pittsburgh, Allegheny County, Mon Valley, all those that we serve. That brings us to, what about the Johnson & Johnson recall? So everyone was wondering what was going on with that. That post, everyone was already skeptical of, things before, and then the J&J recall happened. So what are you all's thoughts on that?
So it's a very tricky one. I think I'll bite first, I guess. So with the recall, it was a pause, I guess. Not so much, and the pause actually has been lifted now. And I think, this was part of. This was kind of part of the design where, we monitor safety, and if there is a safety concern, we as we said, trying to take a pause and make sure that, we stop things while we collect more data or kind of look at the current data. I think the initial flag was raised with, I think, 6 cases of cerebral sinus thrombosis, and which is a clot kind of in the blood vessels of the brain, which is a serious thing. It's not just kind of like a minor clot in the leg. And these were all occurring in women and cis women, I think, between the ages of 18 and 48, I think. So, and because it's a rare and severe kind of side effect, this is, of course, though, I think it was around like 7 to 8 million doses given. So it's a very small number of a rare thing amongst like a very large denominator. And so what do you do with that? And I think what they did was just pause. And I think this sort of illustrates that the system was working the way it was supposed to work. This is how we say that, we are worried about safety and we just want to be careful. But it's not necessarily saying that we really think this is something that like, oops, we made a big mistake. This is something that's truly dangerous. They just wanted to collect more data. And at the end of the day, I think they looked at it and they said, no, we can move this forward. The problem with that is that there was a lot of media speculation. There's kind of people who were already on the fence, and this kind of put them in the other direction. But I guess my take home is that it was part of the safety strategy from the beginning. And we when we see these kinds of events, they're small numbers of events, and we do expect things to happen because amongst millions and millions of people, lots of things happen every day, car accidents, but we don't necessarily think that car accidents are related to the vaccine. But when it's something that's very rare and kind of hard to explain, then we sometimes can potentially tie that to the vaccine. And that's why we have to take kind of a closer look and make sure that it is not related.
Thank you so much for that. And thank you for bringing up, and before we get into the other answers, I just wanted to put in there, trans women have been really concerned around that because of the blood clots. When we take estrogen, we're already at risk for getting blood clots. And I know that has been a conversation within the trans community as well, like, whoa. So yeah, while we're, answering that question, if anyone wants to touch on that, that'll be super helpful too.
Yeah, I can take that piece. I think, definitely I agree with Ken that for me, I was actually surprised that they paused it because I was like, oh, so we're not just going to blow this off. That's nice, right? So it was actually, to me, like a show of public, like the CDC saying, okay, the public is really looking to us to make sure that we're doing our due diligence. And like, even though it was risky to pause it because of the media speculation and all of that, they still paused it. So I thought that that was great. So in terms of being on estrogen and clotting risk and all of that, so the clotting risk that we quote when we talk about clotting risk with estrogen is actually based on clotting risk from ethinyl estradiol, so synthetic estrogens that like they extrapolated the information from birth control and contraception, things like that cis women are on. The estradiol that we use for gender affirmation actually has a much decreased risk of clotting than the older formulations that we used to use that we get that clotting risk from. So baseline, the risk of blood clots is really low for trans women because we're not using those more dangerous forms of estrogen. And then on top of that, the types of clots that we see with estrogen are not this sort of like sinus thrombosis that we saw with the Johnson & Johnson vaccine. So I think putting all of that together, I would say that the risk is very low, especially if you're on patches. Patches have the lowest risk of clots, period, because patches, the way the patches metabolize are broken down by your body doesn't form those breakdown products of estradiol that lead to clotting. So definitely, something to talk about with your doctor. If anybody has specific questions to them about that, I'm happy to talk you through it because I prescribe hormones day in and day out. So that's sort of like my life. And I can definitely talk to anybody about that who has questions. But I would say the type of estrogen that you're getting has lower risk of clots than other formulations of estrogen out there. The type of clot that was seen is like an extremely rare type of clot that we don't see with hormones. And lastly, depending on the dose of estrogen you're on, the type of estrogen you're on, your risk might also be decreased.
And I just wanted to add just another thing to that, everything that Aloho said is also what some people have talked to me about was selecting if they can choose what vaccine that they want to have. And so I would say if you are uncomfortable with the Johnson & Johnson vaccine, which I do agree that the safety profile is very pristine, even though there are 6 cases out of that 7 million. But I would say that, luckily right now you have 3 different options. So if you're like, you know what, I really don't want the Johnson & Johnson, I'll go with the Pfizer Moderna Moderna, you actually have that ability. So different pharmacies have, have Johnson and Johnson, have Moderna, have Pfizer, so you can ask that pharmacy, if you have like what vaccine that they have, and you can choose to select that. I would say that happened to my uncle. He was like, I don't want them giving me that Johnson and Johnson. I was like, granted, okay, however you feel, but let's still get a vaccine though. So what about that Pfizer, Moderna? How about that? And he actually got his vaccine yesterday, was in Pfizer. So yeah, so I just want to say that there's options out there.
And I was just messaging in the chat just to confirm that Pfizer is what is available on 5/23 for the SisTers Pittsburgh. So no concern there. Pfizer. And there is a difference in the vaccines, and you should know that information. The protection is different between Pfizer and Johnson & Johnson. The big benefit of Johnson & Johnson is that it's one shot as opposed to Pfizer being two. But I think that if you have the opportunity to get the Pfizer or Moderna, those are the ones to go for.
Thank you all so much. And just for clarification, if you do, register to get your vaccine at SisTers PGH, you will also be scheduled to get your second shot. So you will have that as an availability as well. We did have a few comments in the chat, and I'll start with the difference with estrogen, specifically, the difference between shots versus pills and the vulnerability of that. It's still just concerns around, clotting. Again, we have Pfizer at SisTers PGH, but again, just for clarification for folks who may be thinking about other options.
Yeah, so I want to just reemphasize that the risk of clotting from estrogen for gender affirmation is like really, really low. And it's probably lower than what we quote you when we talk to you about it, but it's just because the data that we have that we use to extrapolate is from, like data that used other types of estrogen, like synthetic estrogen from horses that like has a higher risk of clotting. So that's just baseline. In terms of the reason there's a difference between pills, injection, and patch is the way your body breaks it down. When you get the patch, it doesn't go through the liver to be broken down, so it doesn't get those byproducts that put you at increased risk for clotting. So that's the difference. Now, I'm hoping that in the future we'll have more data that's specific to trans women in like this new era when we're using safer estrogens, because I think what we will find is that the risk is so much less. And honestly, when I'm choosing or helping patients to choose, talking to them about which types of estrogen to choose, only if they're already at high risk for clotting do I say maybe we should try patch. I usually go with patient preference because the difference is small, but if they already have had a clot before or have really high risk factors for clotting, then I might be more like, okay, because you're at higher risk, what do you think about doing the patch instead? But honestly, like I probably put more people on the other forms than the patches because a lot of insurance, depending on what type of insurance you have and all of that, you may not even have access to the patches.
Here I go talking on mute again. No, that's really refreshing to hear. Considering, in Pittsburgh, us as trans people, not just trans women, trans and non-binary people, LGBTQ folks, right? We have a hard time finding safe medical professionals, and I use quotations, medical professionals in Pittsburgh that can give us, trans affirming, LGBTQ affirming care that really makes sense, that is safe for us, and that is actually professional. And I use the emphasis on that because there should never be a time where, someone becomes too comfortable with our community where it turns into unprofessionality within the community. So That's really refreshing to hear, and you might get a new patient. But yeah, if anyone else wants to chime in on that, I think everyone may have answered that question. But if anyone else wants to chime in, feel free. Okay. All right, so we have another question here. So what happens immediately after getting vaccinated? Will I faint? Am I more susceptible to getting sick? Would I be able to take care of my family and go to work? Whoever wants to jump in.
I can go ahead and start off with that too. Yeah, I mean, in terms of like the immediate side effects, I think, well, I mean, of course, there's the injection itself. And some people, when they get injections, do kind of have a response where they might feel lightheaded or pass out, but that's sort of not specific to the COVID vaccine necessarily. I think the most common side effects associated with the vaccine are fevers, achiness, tiredness, actually some mild versions of COVID-like symptoms. And just kind of to recount my experience as a study participant, where it was a 50-50 chance that I was going to get the vaccine versus the placebo. I wanted the vaccine. And so I was like sort of waiting that night to see if I had any symptoms. And I didn't have any symptoms that night. So I kind of went to bed slightly disappointed. But then I woke up the next morning and kind of walked up the stairs. I was like, wow, that took a lot more energy than it usually does. And I was like, oh, I think it's hitting me. And so, yes, in fact, I did get the actual study vaccine. Sore arm, I think, is another one, which is quite common. And the thing is, it's I think the general patterns we've been seeing, and it's not consistent across everyone by any means. I think people oftentimes do fine with their first dose, but then sometimes on the second dose, that's where the more severe symptoms hit. And I tend to think of it as it's almost like the immune system got primed the first time, and then now it's ready to go in the second time and kind of having a stronger response. And so you feel that in the form of symptoms that are kind of like mild flu-like symptoms. Some people, for me, it was about 2 days of feeling pretty tired and wanting to just be in bed, but it wasn't. I would do it again in a heartbeat, and it and I think if I had a chance to plan it, planning it over the weekend is helpful, because I do think it's going to work like that. It would take some ibuprofen and some sympathetic souls around me. So, and then my experience, I think, wasn't everyone's experience either. Many people had no symptoms at all. I think there are other thoughts that perhaps maybe younger individuals tend to have a little bit more of a strong reaction, but I don't know that that's truly published. It's just sort of something that we observed in some of our trials. And so, yeah, I think just kind of in summary, just some mild flu-like symptoms, sore arm, lasting 1 to 2 days, I think is perhaps most common, usually with the second dose. And so those are, I think, the most common symptoms with the COVID vaccines.
Anyone else wanted to jump in there?
Yeah, I agree. I had a similar experience with receiving the vaccine, that the first shot didn't really feel much of anything. And the second shot was very tired for about 36 hours. So again, it's individual response. Some people, my husband did great. No, it was a joke though. I was like, did you get the vaccine? No, but he did great. He didn't have any symptoms whatsoever for both shots. And so I think it's individual. I do think it is wise to just, let your community, family, folks, friends know that you're receiving the vaccine, and just prepare that you may be a little bit tired. And so trying to have a little bit of assistance, really good self-care for yourself, 48 hours post having your shot, both for the first and the second, especially for folks who maybe already had COVID. Your first shot, you may have symptoms because your immune system has already been primed. So just preparing yourself for just a little bit of self-care those first 48 hours. I do think that, like Dr. Ufamata was saying, it's important to know yourself and know your health history. And if you have any concerns, right, regardless of if you're on this medicine or that medicine, we have to talk to patients about, some patients may be on immunosuppressive medicines. And so there's counseling that does need to be had for some patients. And so your health history and having that conversation with your provider or a nurse prior to having the vaccine, I think is important to have, and being informed again about your individual situation and asking those questions are important.
Awesome. Thank you so much. Yeah, so another question. I haven't gotten COVID since the pandemic started. I'm immune to it. I don't need the vaccine. What do you say to that?
I say you're really lucky. But it depends on the type of person you are, how far do you think that luck is gonna go? I haven't gotten COVID throughout the pandemic, but for me, it felt like it was inevitable. Like I was gonna get it at some point. I'm seeing, I work in a public facing job at the hospital. At least at the hospital, we can kind of, tell people that they have to mask. Depending on your job, you may not be in a situation where people are always masking around you. Even going to the grocery store, like even that was a risk. Like I didn't go to the grocery store for like months because my husband went to the grocery store. So it's just that. And right now, yes, we have the vaccine. Yes, the vaccine works, but we're still only about 30 some percent of people who've gotten vaccinated, right? So COVID is still out there. We're still diagnosing people with COVID. We're still seeing people in the hospital with COVID. I had a patient die last week from COVID, right? So it's not gone. It's not something that all of a sudden, is just disappeared because we have some people who are vaccinated. So I think, and maybe I'm pessimistic, but I felt like it was inevitable. And so actually, Dr. James and we got our vaccine the same day. And I saw her in the room after she got her vaccine. I walked in and I saw her and I almost cried. Like I had my daughter in February and COVID hit in March. So I had a newborn the whole time. I'm working. I'm like, I'm gonna bring this thing home to my family. My family's gonna die. Like I've had family members, not my immediate family, but I have family members as well. It's almost like there's few people who can say that nobody they've loved has been touched by this thing. And so kudos to you. I think that's great, but I don't bet, like I keep my money in my purse and I buy things with it, but I don't bet. So I'm gonna go with a sure thing because if I have something that's gonna even further decrease that chance, that's what I'm doing. So I think it really just depends on the person, but I wouldn't say that just because you haven't gotten COVID, that means that you're immune. I would say that means that you've been faced with a lucky set of circumstances. But this is your chance to take it out of luck, to take it out of chance and do something about it. So
I agree. I think that I'd like to echo the point about there are people who can be carriers and be asymptomatic. So, one, actually knowing that you've not had COVID is tough unless you've been tested, right, to show. So, people can be walking around with COVID and be asymptomatic. And that's important to understand, right? So, your immune system may be handling it so that you may have vague symptoms like maybe a headache or a cold, but we have to remember that this virus is not just affecting us as individuals, that it's affecting our community. So like Dr. Ufamata was saying, like I had to get the vaccine. I helped to, care for my parents, right? And so if I would have brought that home and they're vulnerable, right, to having complications, that would have been devastating to me, right? So when we make the decision, yes, it is an individual personal decision, but just remember our personal decisions sometimes affect the person who's next to us. And that could be a loved one and someone who could get it and get really sick from that. And so carrying that burden was just way too much for me. And knowing that there was the option to be less concerned about that with safe practices, right? And so that was important for me to help to decrease like the likelihood of spreading it and all of those different things. So I took that into consideration as well.
Yeah, I know. Oh, go ahead, Dr.
Oh, no, and I think sort of somewhat peripheral to that, but I just wanted to mention as well as, talking about the benefits of the vaccine, both from the standpoint of individual health as well as the community around you. Sometimes people ask the question like, well, okay, if I can still get COVID without symptoms, what's the point anyways? Am I still transmitting it to other people? And we do think that the vaccine itself does, seeing what we've seen kind of in different communities, it does reduce your risk of spreading COVID to other people, even if you have asymptomatic infection. And so I think that's worth bringing out as well as another benefit of getting the vaccine.
Thank you so much. Yeah, it was hard for all of us, I'm sure. Those who weren't able to see our families. I'm used to Sunday dinner at mom's. And if I can't get my Sunday dinner at mom's, it's gonna be a problem. And it turned into a situation where my mom, she would cook the dinner, put it in Tupperware, put it on the back porch. I would go pick it up and we would just wave and kiss to each other across the yard. And I would go home and eat my Sunday dinner that my mom made for me. And so, yeah, every week we have all been feeling it. And I was definitely worried about my mom. I have two younger brothers who like to be in and out of my mom's house. And even as siblings, right? Even as siblings trying to navigate with our other siblings, like, chill, y'all. Like, you can't be going over mom's house. You can't be running in and out of grandma's house. Like, you can't do that, right now during COVID. We got to make sure that they're okay, first. Before, we want to love on them, we want to get the food, we want to get the love, but we got to make sure that they're there to continue giving that after this pandemic. So making sure that we're taking our seniors and parents into consideration when it comes to the pandemic. So yeah, we're almost at time, but we have another question specifically for, again, our trans communities. A lot of trans folk have been either turned away by a doctor or healthcare provider or experienced harm, discrimination, or harassment while seeking medical care. How inclusive is UPMC's team to TLGBQ plus folk going to be in vaccination sites? And how are you working around triggering language? Whoever wants to start.
I don't know if Joy, I didn't know if you wanted to take that one, but that's real. That's so real. I'm not intimately involved with the vaccination, like the logistics behind vaccination planning, so I can't answer that, but I just wanted to echo what the question that's being asked. I think it's a very important question. And just from the outside looking in, that's why, to me, the fact that SisTers is hosting a clinic is so important, because that's family, that's family bringing the vaccine to you. Like, you can trust that y'all not gonna let any kind of raggedy stuff happen, right? You're not gonna, right? Period. You're not gonna have raggedy stuff happening at the vaccine clinic. So to me, I think that it's not even really about UPMC. It's about the fact that it's partnered with a community organization that is rooted and grounded in the TLGBTQIA community, in the of color, specifically a community organization that you can trust. So that, to me, speaks a lot louder than anything else.
I'll just say too, I mean, and certainly Liz can jump in. So, you know, we definitely have work to do. We for sure have work to do. You know, the healthcare community has work to do. UPMC has work to do. And, you know, what I can say is I witness colleagues and leaders who are doing that work, you know, and are committed to doing that work. And we are not above reproach. And, you know, so what I would say is, like, I think the request that I would have as someone who makes sure that we're doing this, wants to make sure that we're doing this right, is that if y'all have critical feedback, we want to hear it. If you want to share that feedback anonymously, there's definitely ways to do that. We can make sure SisTers has that information. If you want to share it with a face and a voice, we want to hear that too. You know, and again, we don't want to suggest that we're perfect. You know, I will say, when we're thinking about the vaccine clinic specifically, when we were like so blessed that CRU and SisTers were open to hosting this and letting us come and do this vaccine with y'all, we really wanted to make sure that this felt like very safe and very like wrapped in whatever SisTers wanted this to be, you know. So and I can say, and I think Liz would second this emotion, like, you know, if we come and we do 200 vaccinations on Saturday or Sunday, and then, you know, in a few months people are, you know, interested, maybe people are still feeling a little bit hesitant, but maybe a little bit later on they want us to come back. And, you know, the hope would be is that you all have a really positive patient experience, and that you would want that again. And we certainly have that commitment. So we want that to be something that we're committed to. Yeah, but we have a lot of work, and Ciara knows, and Misha knows, like, we've been having conversations about the places that we need to do, you know, better, even just around this form that we showed you tonight, you know. So yeah, I don't know, Liz, if you have another something else to say.
To just admit, right, that this is real. We have so much work to do in terms of helping our healthcare delivery system even begin to recognize the harm that's been done. And, you know, I think the fact that so many of our health professionals were so excited to actually join this event this evening also reflects, right, this dramatic kind of tectonic shift that 2020 brought for us. The fact that, you know, Dr. James is teaching a course on racism in medicine, amazing. The fact that the next generation of health professionals are not going to have to put up with the BS that I did as a medical student, right? And I'm still like totally furious that they still haven't fixed the form when we asked them to say put MX in the like prefixes, right? And so this is my job, and my commitment is, as the health professional that's been designated to work together with Dr. Tracy Conti, who's one of my heroes in this space as well, that the two of us are committed to making sure that those people in our community who have historically been marginalized, who've historically been forgotten, who historically experienced so much harm from our system, that our commitment is to prioritize your experiences and to ensure that people receive vaccine in ways that feel affirming and that really represents the warm hug that we all deserve. We all want to be cherished, and that is my commitment to you.
And this goes beyond the vaccine, right? This is a way of establishing our partnership, our relationship with each other. So, the future is very bright. We're definitely moving in the right direction. And as everyone has said, we really want to hear from you, because our perspective, the traditional way is that we as providers say, oh, there's an issue, this is the way we should fix it. but that's not the perspective we need. We need to hear your voices and what you see as the problem and the way that we can work together to fix it. So this is a powerful change in the dialogue, right? Not just providers saying you need to do this, this, and this, or, you know, I'm not going to treat you. I really enjoy sitting down and having conversations, right? And talking with people. And it's a mutual learning situation, right? There's a certain amount of knowledge that you are sharing with us and helping us to be better providers. And we are doing our best to deliver care that is equitable, right? That it is the care that you need, that you desire, and that you deserve, right? And so I think that we're at a good spot, and we really are powerful together, collectively working to figure out these issues and these problems.
Agreed. Dr. Tripp, did you want to add anything additional? They're messing around. Okay. But yeah. This is truly, and just for visibility, I mean, I'm sure it's no secret, when we first heard, got the email about UPMC wanting to do a vaccine clinic with us, we were like, and that's just honest, honest invisibility around that, just because of, what's been going on within community. We're a part of the community, like we're grassroots people. We work with people in the community. So we listen to them, we follow them, they listen to us and follow us. And it was definitely a moment where we had to like come together as a team, like, well, how do we move forward? And it was more so, well, if they're going to listen, if they're going to learn from those that we serve and they're open to that, let's do that. And us as an organization, those in our community know SisTers PGH, we don't hold back on what we need to say or do in reference to making sure that our community is served in a good way, in the right way. And if that is a continued learning lesson, for us all, I think that is worth the relationship and partnership. And so I'm excited, about that, and just seeing what the future holds. Again, we need safe medical spaces in Pittsburgh. We are really struggling to find safe spaces. Even referrals, when we're doing referrals in our organization, and we're asking, during our normal intake process, whether it's in our housing space or whether it's them coming into our community center, do you have a doctor? And a lot of times it's no, or a lot of times it's yeah, but I don't want to go to this place because these people are trash. And so it's just an array of things that we're trying to navigate just to make sure that our TLGBQIA plus communities of Pittsburgh have affirming spaces to go. And we have so much work, but we're the patients. We're the patients. And if we can find space, if we can continue healing and having conversations around, this service provision that is medical care, this is going to be great for us as community members. And yeah, before we close out, because we're closing out now, we have one more question that popped in. And after this question, if our doctors can please provide your contact information. Just let everyone know where folks can contact you at for anything, if it's for, hormone therapy, if it's for medical services, this is for anything, how folks can contact you. So the last message we had was, how do y'all feel about the CDC saying y'all don't gotta wear your mask? Keep your mask, or y'all can go out unmasked. Me personally, no. But I would love to hear from the medical professionals around this.
I can go first. So I'll admit, Elizabeth, I am still choosing to wear my mask just because my child who like had, did a photo bomb right now, is 2 years old. She's not vaccinated. So I would say we still have populations that are still not vaccinated. So to automatically say that everyone does not need to wear a mask. And even though there's a rare case that, you being vaccinated and still having the COVID-19 infection is possible. So that's why I would say that I would still, recommend for wearing the mask, just be cautious that not everyone is vaccinated at this time. So, but that's just my opinion.
Yeah, I think I have a similar opinion as well. Just, I mean, from the standpoint of the CDC guidance, I think it sort of specifies, amongst people who are vaccinated, and it's so hard to confirm, and and sort of, we don't have a system for really doing that, and so kind of being aware that that is almost impossible to kind of achieve, like amongst large numbers of people. And then of course it's large numbers of people where you have your highest risk. I think it's just a safer thing to wear masks, especially indoors. I mean, I think when you are outdoors, it is a different situation. There's a lot more circulation and lower risk. But of course, then there's kind of the spectrum as well, from just like sort of jogging in the park to kind of like big mosh pit in an outdoor concert. And so I think I think as people in medicine, we always do tend to be a little bit more on the careful side, and I don't know that it makes sense to abandon that at this time.
Same. I'm definitely still wearing my mask. When I'm around people I don't know, if I don't know their vaccination status, I'm definitely wearing my mask.
Oh, and the other thing I did want to add too, since I'm in the emergency department, that we actually had a lesser of flu and colds that are coming into the emergency department. So wearing the mask actually has helped to prevent other viruses from being, transported to other people or infecting other people. So that's another reason why I would say keeping the mask is actually helping to like kill three birds with one stone type of deal.
Dr. James, did you want to add anything in there? Did you want, if, or did you already? I may have, it's getting the end of the night, but did you have anything to add to that?
So I didn't have anything to add about the mask. I've been, consistently masking. There is one topic that we wanted to bring up, just different populations and different exposure. And there was, different, circulations about questions about PrEP usage, and prophylaxis, for HIV infection and getting the COVID vaccine. And we just wanted to address that is not on any of the list of medications that need to be stopped, or there's no contraindication that we know of for using those. If anybody else wants to chime in on that issue, because that's really important to understand. So I just wanted to make sure that there was a little bit of discussion that was brought up amongst the group on that topic.
Yeah, thank you so much for bringing that up, because yeah, I was like, I know you had contacted and brought that up as previously as well as an important topic. And yeah, I kind of was wondering like kind of how that arose, and I may be making things up as well, but I know that there were some speculations that some of the different vaccine kind of vectors that for some of the adenovirus vaccines, which are used to make some of the COVID vaccines, were associated with a higher risk of HIV acquisition. I don't know if that somehow contributed to that, but the vaccines that use that particular vector are not the ones that are in circulation right now. I think one of the Chinese vaccines, in fact, and so not really an issue with any of the vaccines that we're using currently. So no increased risk of HIV acquisition, and I don't think any impact on the efficacy of PrEP.
Thank you so much, Dr. James, for bringing that in the room. That definitely was one of the questions Again, it's been a long night, but thank you so much for bringing that up. I see all of you put your information in the chat over here in Zoom, but if you can verbally say them for folks that are watching from Facebook or that'll be watching from YouTube, we'll still copy this and put it in the comments. But if you can just mention to that in your field of practice so folks can get in contact with you, that'd be great. Whoever wanted to start.
Sure, I can start since I don't have a clinic. So no one can. So I'm an emergency medicine physician, Dr. Raquel Tripp, and my contact is Tripp, TRIPPRP at upmc.edu. So if you come to me, it's going to be in the emergency department, and hopefully, yeah, it'll be a bad situation if you see me. So compared to my other colleagues, which that'd be a better situation.
Yeah, I'm Ken Ho. I'm at the Falk Clinic in Oakland. In my clinical, I guess my clinical piece is HIV care, but I also run the UPMC PrEP clinic as well. So HIV care and HIV prevention is what I do. Oh, sorry, HOK2, HOK2 at upmc.edu. Sorry.
I'm Ella Hofomata. I'm a primary care doctor at General Internal Medicine Office in Oakland at Montefiore Hospital. Our phone number is 412-692-4888. I do gender affirming hormones if anybody's interested in that. My email is ufomataeo@upmc.edu.
I'm Elena James, general medical dermatologist at UPMC. I see patients at Falk Clinic in Oakland and Shadyside. I also am blessed to be able to see patients in community clinics. So I go to the Northside Christian Clinic. I go to Birmingham Clinic. I also have affiliations with the Women's Shelter, Squirrel Hill Health Center. So we're really making a big push to bring dermatologic care to the communities. So I'm happy to see patients at any of those places. I'm at jamesaj@upmc.edu.
Well, we have come to our end of the evening. I want to thank everyone. Joy, Liz, thank you so much for reaching out, pulling us all together to have this important conversation. Thank you to all of our doctors that were here to explain the situation, and thank you for your work. Right, especially during this pandemic, this has been tough on all of us, especially our nurses, our doctors that have been in it. So thank you, like truly, 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 thank you for your work. Again, we have our clinic happening at SisTers PGH this Sunday at 12 o'clock noon to 4 p.m. If you have not registered, please get registered. We'll put that registration information in the chat of this. You can also see it on our Facebook page, Instagram, and Twitter, as well as all the contact information for the doctors. And again, as we close out, 70% of Pennsylvania is still not vaccinated. So let's make sure that folks, if this is something that you want to do it. Do it, and make sure if you want to go to the club, if you want to go travel, you want to go do you, just take those precautions, for you to do that. And without further ado, again, thank you everyone for this tonight, and we will chat soon. See you on Sunday.